I am Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Urology and Multispeciality Hospital, Bengaluru. Hello, today I will be speaking on the issue of kidney stones. Kidney stones is a huge topic and I will be covering only a small part of it and the most common part of it. Now, what is the context? Nowadays, most of the people undergo health checkups or they undergo ultrasound examination just for curiosity to make sure that there is no abnormality in their body. And after the health checkup, which includes an ultrasound of the abdomen, we commonly see reports like a 5 mm kidney stone or 6 mm kidney stone either on the right side or on the left side. This is detected only on ultrasound and the patient has absolutely no pain whatsoever either before the evaluation or after that. When they come back, they come to me with the report and say, my master health checkup or executive health checkup ultrasound showed that I have a kidney stone. What should I do about it? Well, many times a small stone, something like maybe about a 4 mm or 5 mm which is detected on ultrasound in the kidney, we usually don't treat those stones because anything up to 4 mm or sometimes even 5 mm with adequate hydration, that is drinking of water, comes out and passes into the urinary bladder and out of the body through urine. That's why we don't treat. However, a stone which is bigger than that, like for example 6 mm or 7 mm in size, is unlikely to come out of the body on its own because of the size. In such situation, we give the option to the patient to either get it treated or keep himself or herself under close observation by doing ultrasound every 6 months to 1 year. So a regular ultrasound will detect if the stone has remained in the same place and also whether it is growing in size. If the stone is growing in size, then it needs treatment. However, if the patient has no symptoms at all, the stone is in the kidney and it is not growing in size, we continue to observe it. There are only some situations where we advise the patient to undergo some procedure for a 5 or a 6 mm stone. For example, if he is traveling abroad, because when he travels abroad and suddenly if there is a pain or if the stone in the kidney comes down to the ureter, it becomes an emergency, and outside India where the medical services are different, it becomes very difficult to treat those stones there. In such situations, we ask them to undergo treatment here before they travel abroad, especially if the travel is a long travel. The second situation where we ask the patients to undergo procedure for a small stone also is in special occupations like pilots, sailors or even drivers, because especially in pilots and sailors, if the pain comes, they are in a difficult situation and also the treatment is difficult, and in drivers it jeopardizes the safety. So these are the special situations where we ask them to get them treated even when the stone is about 5 mm in size. Now, what are the options available to treat such stones? As I said, conservative management, that is adequate hydration, enables most of these stones to come out of the bladder as long as they are about 5 mm in size. Any stone about 5 to 7 mm in size, the best option would be a procedure called ESWL, that is extracorporeal shockwave lithotripsy, in which sound waves are directed at the stone and this stone breaks down into small fragments or is powdered, and the patient is able to pass these stones pieces through the urine. This is commonly called lithotripsy or shockwave treatment. The second therapy for such stones is a procedure called RIRS, which is a procedure wherein under anesthesia an endoscope, which measures about 3 mm in size, is passed into the kidney through the urinary tract, natural passage where no cut is made. This instrument is passed into the kidney and we use a laser to break this stone. These are the two ways in which a small stone can be treated. The lithotripsy or using sound waves does not need admission, it does not need anesthesia. At the most, it needs an injection painkiller or a tablet painkiller during the procedure, and it takes about 30 to 40 minutes for one session. At the end of the procedure, the patient will go home, he will be on normal diet and he is asked to eat normal food and drink a lot of water so that the pieces come out. In RIRS, the patient is admitted. It is done under general anesthesia or spinal anesthesia in the operation theatre, and an endoscope is passed and at the end of the procedure, after a stent called a DJ stent is kept. This DJ stent helps in the normal natural passage of the fragmented stone, and this stent is removed after 10 to 15 days. The hospital stay will be either from morning till evening or 24 hours. So these are the two ways in which a small stone in the kidney can be treated. Thank you.